My name is Jack Steele, and I'm an orthopedic surgeon specializing in hip and knee replacement at Towson Orthopaedics. I chose to be an orthopedic surgeon because it's a specialty where you can really improve people's lives, and specifically hip and knee replacement because it's a surgery that really dramatically improves patients' ability to perform the activities that they enjoy doing. I love what I do because I can see the improvement that I am able to give people through hip and knee replacement. Patients often come to us in a very debilitated condition where they're having difficulty walking, doing the activities they enjoy doing, sometimes to the point where they're using a cane or a walker. And after surgery, we can see a dramatic improvement fairly quickly after surgery. I think at TOA and St. Joe's, we do a great job at providing personalized care for patients. We have, I think, a great sized group of orthopedic surgeons where we have about 20 orthopedic surgeons. We cover all the subspecialties, so we're able to cover all the body parts of orthopedics, but we're not so big where patients get lost in the shuffle. And so I think patients really feel that personalized care that we're able to provide at Towson Orthopaedics. And at St. Joe's, we have a great team of anesthesiologists, surgical assistants, and so I think we provide great personalized care. So I got my undergraduate education at Dartmouth College. I went to medical school at Georgetown University. I did my orthopedic surgery residency at Duke University, which was for 5 years. And then I did an additional year of training in hip and knee replacement at the Hospital for Special Surgery in Manhattan.